Have you heard things like, oh, diabetics have a lot of foot issues, right? Diabetics have foot amputations. Diabetics have wounds, sores on their feet that take forever to heal or never heal. Are you or someone you love dealing with diabetes and you want to avoid chronic wounds, ulcers, amputation? Then this video is for you. My name is Dr. Tarr. I'm a board certified podiatrist in practice here in Phoenix, Arizona, and I actually own a small clinic, Direct Podiatry Arizona in Tempe. And these are the top 7 diabetic foot issues. Diabetes can affect your feet in a lot of different ways. There's a couple different reasons why diabetes does so much damage to your feet. One diabetic foot problem that's common but can be overlooked just because people don't connect this problem with diabetes usually is actually dry skin, because diabetes actually can affect the nerves that are responsible for sending signals to your sweat glands and to your oil glands in your feet. So if these glands aren't able to work as they once did, then your skin is less likely to become lubricated, moisturized. Ever noticed walking in a grocery store, in a pharmacy, and you see lotions that are labeled for diabetics or diabetic foot cream, diabetic lotion, and actually isn't a marketing gimmick? It's true, and it's definitely very needed. This can be one of the things that left unchecked over time with a lot of the other diabetic foot issues that I'll go into can actually lead to wounds to swell. So if you're diabetic, definitely be very diligent about moisturizing your feet daily, at least, if not twice a day. As a diabetic, you should be seeing a podiatrist at least once a year. The second diabetic foot issue, corns and calluses. A sign of usually friction, rubbing inside of shoes and pressure over time, and a foot of someone that has diabetes combined with all the other issues that I will discuss can increase your risk of chronic wounds, ulcers, infection, and amputation. So if you're diabetic and you notice any new corns or calluses to your feet, again, please see your local podiatrist. We oftentimes can address these changes in your feet before they become a bigger issue. The third diabetic foot issue are changes to the shape in your foot, hammer toes, bunions, changes in the arch height of your foot. Sometimes a foot affected by diabetes, the arch can become higher, known as a cavus foot or a high arch foot. Sometimes the arch of the foot can become flat or collapsed, known as a planus foot or flat foot. This happens because diabetes also can damage the nerves responsible for sending signals to your muscles to contract. And over time, if your muscles aren't getting as many of these signals or no signals at all, if you don't use it, you lose it. And muscle is one of those things that if it's not used, it'll start to shrink or atrophy. Atrophy in the foot looks like different types of foot shapes that you didn't normally have before, because now that delicate balance in the foot is thrown off. So joints have more freedom to just move however they choose to move. This is a big problem in the diabetic foot because combined with everything else that can happen in the diabetic foot due to the high blood sugars, this again can put new pressure on parts of your foot that weren't designed to take up that level of pressure. That can lead to corns, to calluses, and calluses and corns in a diabetic foot, along with blisters, can become ulcers very quickly. The fourth diabetic foot issue are sensation changes, feelings in your feet, or lack of feeling. Neuropathy, peripheral neuropathy, or diabetic neuropathy are all terms used for the nerve damage that happens in your feet because of diabetes. So studies have actually shown that it only takes a blood sugar of about 140 to start this process. And if your blood sugars stay elevated, this continues to happen, the breakdown and the damage of the nerves in your feet. Chronic pain also is common with neuropathy as well. And that can be also very devastating. It keeps people up at night, can completely change your life. If you're noticing these symptoms, please see your local podiatrist. Okay, and the fifth diabetic foot problem is circulation issues. This is another big one. Along with the nerve damage, that can come with diabetes and the high blood sugars, and along with the foot shape changes and then the changes to your skin. Hopefully, now you're starting to see that the risk of someone with diabetes developing a wound, an ulcer, or amputation are coming from a lot of different places, right? Diabetes can cause plaque buildup inside of the blood vessels that serve your feet. Diabetes also can cause calcium buildup inside of these blood vessels, specifically your arteries that serve your feet as well. It's really interesting. Sometimes some of my patients with diabetes, if I'm ordering an x-ray, for example, for something completely unrelated, maybe they had a fall and they're having foot pain, and some people, I order that x-ray and I can actually see the outline of some of the major arteries in their feet on x-ray because their arteries are so calcified. Interesting from a scientific or medical standpoint, but very concerning because arteries that have that calcium buildup in them, they won't be able to work normally. They won't be able to move the amount of blood that is necessary for that part of the body to be healthy. Arteries are meant to be flexible, to expand. And when you have calcium inside that artery wall, it becomes a lot harder to do that. Symptoms of poor blood flow in the diabetic foot can look like a lot of different things. Sometimes patients will notice that maybe they had hair growth on their legs and now the hair growth is slowing down, or they don't have any at all. They don't have to shave anymore. They don't have hair on their toes, which in theory sounds great if that is something you're concerned about. But noticing that without having done any type of treatment and having that be a process that you're seeing slowly develop over time can be cause for concern. Other signs of poor circulation in your feet can be your skin becomes very thin, tight looking. When this starts to happen to your skin, it's very fragile as well. So any type of accidental cut or scrape takes a long time to heal, a very long time. Again, because blood flow is key for healing. If a part of your body isn't getting enough blood flow, it's going to be very hard to heal, if at all. Any type of skin injury in someone with poor blood flow to their feet or legs can be a recipe for disaster. These wounds a lot of times take weeks, months, if not longer to heal. In combination with the high blood sugars from diabetes, diabetes also impacts or can impact your immunity too, making it a lot harder really just to heal anything, let alone any type of wound or ulcer. Diabetes also can make it really hard to fight infection as well and to mount an immune response, meaning your immune system knows that when there's Vader there and it has to go and attack that bacteria, that fungus, that virus, whatever it is that's causing havoc in your body. Having diabetes can make it a lot harder for your immune system to work properly. And this, again, can be very devastating because infections in someone, especially with PAD or PVD, it's normally called peripheral vascular disease, and diabetes can get out of hand so quickly. I've had patients that come in with a pinpoint ulcer on their foot, so small, just like a tiny little pinhole wound. And within a couple days, their leg is gone because of amputation, because we're just cutting because of sepsis, severe life-threatening infection, right? And once you kind of get to that point, it's really the amputation or your life. Other signs of poor blood flow can be cramping. Cramping once you walk a certain distance or you do a certain amount of activity. But this cramping in your feet, legs, or even your butt can be very intense. Some of my patients or some of these patients that have vascular disease, it's cramping after they walk, let's say to the bathroom, for example, to the mailbox, to the kitchen. It's a very specific amount of steps or amount of time that they're exerting themselves before the cramping happens. Once vascular disease or poor circulation becomes super severe, these people will have cramping pain in their legs constantly. day, night, it doesn't matter because at that point, your body is really crying out for oxygen, really crying out for nutrition. And this is a huge warning sign. At this point, in some people, actually, parts of their toe or their foot will start to die off, and this is known as gangrene. Okay, the next diabetic foot issue that isn't as pertinent as the other things that I've discussed, but it's still valid for a lot of people, right? Are nail changes. So this might be one of the first things that you notice after possibly you've been dealing with diabetes for a while, that your nails are becoming more brittle, more thick, they're starting to change color. Maybe they aren't growing out as long. And this again can be due to a lot of different reasons. The poor circulation that can happen with diabetes, also lowered immune response, making it a lot harder to fight infection because of diabetes. So possibly, let's say if you have a nail fungus infection or other things can infect your nails too, like bacteria. If you're diabetic, it can make it harder to fight off these infections. So you'll notice changes to your nails. Circulation problems that can come along with having diabetes too also makes it a lot harder for your nails and specifically your nail root to get the proper nutrition that it needs. And this will definitely cause changes to how your nails grow out. And then the seventh and final diabetic foot issue, and I've mentioned it before, are chronic wounds, ulcers, and we'll just throw amputation in there. Our goal as foot doctors, and really just doctors in general, is to prevent this from happening. And this is why it's so important that if you do have diabetes, to see your primary care doctor, to see your podiatrist regularly, so that we can address any issues going on with you before your foot gets to this point. Now, once you have an ulcer, which is a sore on your foot, it's a special type of sore, a special type of wound that's chronic, and it takes a long time to heal. These wounds are especially difficult to treat because of, again, everything I've discussed, the nerve damage that comes along or can come along with diabetes, the skin changes that can happen with diabetes, the circulation problems that is a very huge factor for being able to heal wounds. If the blood flow just isn't there, it's very, very, very hard for a wound to heal. The immune response, usually once your body gets to the point and starts making ulcers, is a lot lower. So to be able to form new skin and make new skin and be able to heal a wound is very, very, very difficult to do. And so an ulcer and a diabetic foot is kind of like a perfect storm of sorts. It takes a lot of different processes going on in your body and a lot of different changes going on in your feet for this to happen. So again, I know sometimes, or I can empathize with sometimes it can be scary for sure if you are dealing with diabetes and you notice a wound on your foot to go to a doctor. Maybe you've had family members that have dealt with chronic wounds, ulcers on their feet. Maybe you've had family members actually end up having to have an amputation because of these wounds on their feet. But please, 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 if you notice a wound on your foot, immediately see your doctor, because there are ways, even though it is very difficult, there are ways that we can address it, we can treat it, to give you the best chance of being able to heal this as fast as we can. But if something like this is ignored, it's only a matter of time before infection sets in. So yes, these are my 7 diabetic foot issues. Please let me know in the comment section. Are you someone that has diabetes? Do you have a family member, friend, loved one dealing with diabetes? What changes have you noticed in your feet or in their feet? And what has helped? What hasn't helped? If you appreciated this video today, like, share with a friend or somebody you love. If you want to see more videos from me, hit the subscribe button and click the notifications bell so that you'll be notified when I post my next video. And in the description box below, I'll include a link to a blog post that I wrote about my top diabetic foot issues that I'm seeing in my patients. I also do have a email newsletter. Link will also be in the description box as well. Feel free to sign up if you want to receive weekly blog posts from me as well. So that is it, everyone. Take care and be well. Bye.